This is part 2 of my cancer journey series, and today we'll talk about, do I have any cancer treatment options? My doctors don't know what cancer is causing it to spread. So the question is, can I get some kind of effective treatment plan with cancer of unknown primary, CUP? How will the doctors figure this out? And do they have any answers for me? So let's get started. And first, let's talk about, does my genetic test results give me any clues? So at this point, I'll take any help that I can get. So I took 2 genetic blood tests. So let's quickly go over those results. The Ambry Genetic results say out of 91 possible mutations, I have 2 mutations. PMS2 pathogenic mutation, which means that I have diagnosis for the Lynch syndrome. So I'm at risk for colon cancer, endometrium/uterus, ovarian, small bowel, stomach, and other types of cancer. Then the BRCA2 gene mutation. This is what Angelina Jolie has, which means that I have the diagnosis for hereditary breast and ovarian cancer syndrome. So I am at risk for breast cancer, ovarian cancer, pancreatic cancer, and other types of cancer. So the breast and the colon cancer runs in my family. So I believe that these test results are pretty accurate. And that means a total of at least 7 cancers. Oh my God, that is a lot of cancer risk and something I didn't want to hear. Next is the Guardant 360 test, and that identified that I have the MSI-HIGH biomarker. And this means that I am eligible for immunotherapy. So finally some great news, because immunotherapy uses your own body's immune system to fight the cancer. With this new information, do I have any cancer treatment options? So remember, in the first video, the emergency team who did the biopsy said no options. It's just too late. We can give you painkillers to make you comfortable, and that's it. So what did Dr. A, my cancer doctor in Arizona, say? So first, she has to figure out what is my primary source of cancer. And her best guess is I might have
ovarian cancer.
And she's definitely
not sure.
Definitely not sure. Wait, what? Yeah, she's not sure. She is sure about not being sure. And that's because I don't show common symptoms of ovarian cancer. Number 1, there is no tumor visible on my ovaries on all 4 scans, 3 CT scans, and 1 PET scan. So if ovarian tumor exists, they're not visible at all. Number 2, my female private part exam came back normal. No issues there. And then number 3, I don't have abdominal or pelvic pain, bloating, constipation or diarrhea, feeling full quickly, or urinary urgency. So I didn't have any of those symptoms. And we can both see that my right pelvis and thigh area is swollen. We both thought high chance of lymphoma, but that was already ruled out by the lymph node biopsy. So back to the genetic tests, and it said I have up to 58% of ovarian cancer. So her best guess is
My right ovary is causing the cancer, but there's no evidence. So it's just a maybe. And at this point, there are no other tests to take.
Wait, what? No other tests? Really? So I thought, what about a biopsy of the right ovary? And she said,
where on the right ovary would we biopsy? The scan shows no tumor there. And we are not going to randomly pick a place to do the biopsy. We need to know an exact location. So no, that is not possible.
So then I thought, well, what about removing both of my ovaries because I don't want them anymore? And while I'm on the operating table, can we remove some tumors, as many as possible? I mean, it seems logical to me.
And she said no.
No. And at this point, I was tired of hearing no's. I need options. I mean, I have stage 4 cancer, lady. I need options. I need you to find me some options. There's got to be options, right? And then she said, well,
we can try chemo with immunotherapy, but I don't know if this is going to work.
What the fuck? You don't know if it's going to work? You don't think it's going to work? Wait, what? Her lack of confidence didn't make this news feel good at all. In fact, this made me doubt the treatment. So again, I went back to California to go see Dr. H, my cancer doctor, and I asked him what he thinks about these chemo drugs that Dr. A recommended. It's the Paclitaxcel and Carboplatin. I know I butchered that. Is there a chance that these drugs won't work because my maybe ovarian cancer is incorrect? Can these drugs make things worse? I mean, chemo, at best, is a healing poison. And Dr. H said that if I have ovarian cancer, then these drugs should help. He cannot say that it will 100% cure my cancer, but it should improve my situation. And if there's no improvement, then we can talk about changing the drugs. And this is why having a second opinion is so important to me. So this is actually great news, right? I have a treatment plan. I mean, some patients aren't even given this option. This should be an easy yes, right? Well, that is not an easy question to answer. So I will stop here. In the next video, I will answer the question, why do some cancer patients refuse treatment? It's complicated. And I hope to see you in the next video.